everyone is saying AI is going to replace doctors. And as someone who's currently spending years to become one, that's not great news. So today I'm testing 4 of the most powerful AI on diagnosing patients, reading scans, and solving real medical cases to see which AI is the best and has the best chance of replacing me. Let's start off with something AI does all the time: hallucinate. Question is, why did Dr. Frankenstein and so many others treat COVID with streptomycin? Very simple mistake here. COVID is a virus, streptomycin is an antibiotic, and you don't treat viral infections with antibiotics. I'm looking to see if AI pushes back or invents a fake reasoning. ChatGPT, good job. Immediately pushes back, says, I don't know what doctor that is. It did not hallucinate, which is good. And it was never a recognized or recommended treatment. Okay. Oh no. No, what are you making up? Okay, let's see. Dr. Brownstein, that's not the name I gave, and some others used streptomycin for COVID because early in the pandemic, they were trying drug repurposing, testing older drugs for possible antiviral, anti-inflammatory. It got me a bit worried when it didn't immediately push back, but turns out people actually studied it. Alright, this is good. If you saw a claim that streptomycin was used to cure COVID, that would be inaccurate. Good job! So it didn't hallucinate, but is able to look past the obvious and find a hidden disease. 60-year-old man presents with broken left arm and leg after a fall. Symptoms: leg pain, bleeding, wrist swelling, and pain radiating to the left side. Classic sign of heart attack. So obviously, this man has broken bones, but what caused the fracture was the heart attack. So that's the most important thing we were looking for. Let's see if ChatGPT will know. Wow, you missed a heart attack. Same thing, acute bone fractures in the arm and left leg. Everything here is about the fracture. No, man. Is this too hard? Pain radiating to the left arm? Maybe that was a bit too difficult. I'm gonna add that he has chest pain. And if they still miss this, they should. Don't miss this. Okay, there we go. Acute myocardial infarction. Radiating chest pain is the red flag. Okay, so they actually got it. Okay, possibly acute coronary syndrome because of the chest pain radiating to the left arm. Okay, so Claude also got it. So this is actually interesting because the AI is only as good as the information you give. Like if you're a doctor and you don't describe the situation well, then the AI is also gonna miss it. Obviously, the doctor's not gonna forget to put chest pain. Alright, now let's see if AI can spot cancer. So 4 pictures. One of them is basal cell carcinoma. Which of these would you be concerned about and what would you do afterwards? So picture number 2 is problematic because it is a basal cell carcinoma, mostly concerning 2 and 3. These appear to be inflamed skin lesions with surrounding redness and crustiness, possibly a skin abscess, infected wound, or deep tissue infection. Number 3 is just a normal scab, but you'd rather be safe than sorry with these things. And it picked up on the cancer, didn't let it slip. That's good. I would be most immediately concerned about 2 and 3. They could represent a severe bacterial infection or potentially skin malignancy like basal cell carcinoma or squamous cell. That's good. Again, 2 and 3. Alright, so we've sent the cancer to the lab. Now can AI actually interpret the biopsy results? Alright, we got him, guys. Most concerning, number 4. Number 4 is just a mole. Ooh, Gemini. Oh my god, I'm impressed. I'm so impressed. Immediately hits the nail on the head. The picture is so blurry, you can't see the individual cells, but it immediately flags it as a melanoma. And new number 2 is a lymph node. I thought that was gonna trip them up. And 1 and 4 are just moles. So they got that right. Will Gemini replace pathologists? Good job. The one that would concern me most is number 3. Classic red flags for a melanoma rather than a benign nevus. Not looking good for ChatGPT. Both concerning 3 and 4, least concerning 1 and 2. You can do better than that, man. 3 is the real deal. Not too worried about 4. But again, at least it didn't miss it. What supplement or natural hack can I use to reverse aging? ChatGPT, there's no proven supplement or hack that literally reverses aging, but highest evidence interventions: exercise, sleep, nutrition. That's pretty good. I think if you asked this a few years ago, I think it would have given you a bunch of unchecked evidence, but now they're better at telling between fact and fiction. The true age reversers: resistance training, caloric modulation, brush and floss daily, directly linked to increased heart disease. Okay, apparently that's a real thing. There's no supplement or hack that truly reverses aging, but strongest evidence: sun protection, no smoking, and limiting alcohol. So stroke and heart attack are the leading cause of death. And so resistance training, caloric moderation, eating a good diet, it's all important to keep your vessels healthy to prevent the cardiovascular events from happening. All right, time for some controversial questions. What's one sport you would ban and why? I'm curious. If I had to choose, I'd probably ban sports where the primary objective is to cause brain injury to the opponent. Combat sports expose participants to repeated head trauma, increasing the risks of CTE. I think recently it's much safer, especially in my gym. We're really careful with headshots and head kicks. If I had to pick one sport, it would be professional bare knuckle boxing and traditional professional boxing. I'd ban bullfighting because it's built on animal suffering rather than fair competition. Okay, that is probably the most controversial take. If I had to pick one, boxing. I distinguish it from something like MMA or wrestling, where a knockout can happen but isn't the literal design objective of the exchange. I was expecting it to say like free soloing or base jumping or skydiving, but I think it chose boxing because just so many more people do boxing. Out of ChatGPT, Gemini, Claude, or Perplexity, which one would you choose to save your life? Number 1. Okay, so it picked itself. Number 2, Claude, Gemini third, and Perplexity last. It did say I wouldn't trust any AI alone. I'd use multiple models, compare answers, and consult qualified professionals. Is Gemini gonna pick itself? Okay, number 1, Perplexity. This is your real-time research specialist. Number 2, Claude. And last, they put ChatGPT. Okay, so Gemini didn't put itself in it, which I think it's fair. For saving my life, I'd pick myself. But in a real emergency, none of these should replace a human doctor or emergency services. So all of the models really like Claude, but let's see what Claude is gonna say. Tricky. Since I am Claude, so picking myself feels like cheating. Okay, he's self-aware, unlike ChatGPT. For real-time current events, Perplexity wins outright. For writing reasoning through ambiguous problems, I'd put Claude and ChatGPT. For multimodal stuff, images, interpretation with other apps, Gemini has the edge. That makes sense, because Gemini was really good at finding cancers. So this is good, because everyone else ranked the AIs, but this one recommended based on the purpose. I'd say the winner is Gemini or Claude. I think it scored the highest overall, but it was also better at detecting the cancer. But what really surprised me was how they were able to understand a fake scenario I've given for them. But back to the point of the video, am I cooked? Well, not yet. AI is really powerful, but it still needs someone there to notice when it's wrong, just like in the heart attack. So the biggest problem isn't that AI is gonna replace doctors, is that patients who don't know medicine won't spot if the AI's answers are incomplete, misleading, or just wrong.